Okay. Hi, I am Dr. I. Martin Kraus, DO, LCPC. That means I'm a board-certified psychiatrist as well as a licensed clinical professional counselor by examination and licensure here in the state of Illinois. My practice, which is located next to Maison Sabico restaurant in Naperville, is the home of Naperville Family Counseling. I really enjoy working with families and couples and kids. I've been doing it for quite a while now, and historically I've been on the staff of Edward Hospital for over 20 years, but currently I'm office-based in my practice. Before that, I was very active in Linden Oaks hospital setting, having been the clinical director of adolescent dual diagnosis units as well as the residential unit when it opened in, I believe, 1989 for about a decade. And prior to that was on the staff of River Edge Hospital, where I was the clinical director of adolescent and adult units and was involved in people who were severely mentally ill. In those days, I used a lot of medication. At this time of my practice, I'm not using any medication because I really enjoy, I found over the years, of using medical psychotherapy and medical hypnosis and medical hypnoanalysis, which I'll talk about briefly in another video clip. To begin with, I wanted to tell you about how people come to my office or give me a phone call about their children, since my passion is working with kids. And I usually see kids that are one digit in age, like 6, 7, 8, 9, as well as adolescents. I've been doing this all in my professional life and feel quite comfortable treating kids without medications. And where medication is indicated, I usually get a referral source for them to follow through with, or if they'd like a second or third opinion. When you do a lot of medication prescribing, what happens is that there are a lot of side effects. And many times, it really doesn't get to the root of the problem. I use the analogy of a fruit tree. When people come in, they usually have complaints that are conscious and concerns that are conscious, that they're quite aware of. But the issues that underlie these may reflect subconscious or unconscious issues that the child may be plagued by in their own head, as well as the skew in the family setting that occurs because the parents each have their own baggage, which is subconscious, that they bring into their relationship that affects the child in their expectations. Normally children want to please their parents until they get a mind of their own, and then there may be some conflict. In fact, one of the chief complaints that many parents have is that the school told me, for example, the school told me that my child was extremely bright. And when I told my child that he or she was extremely bright, the child decided that they didn't want to excel in the brightness that the school attributed them to. When you talk to the parent may say, I usually was pretty oppositional towards whatever my parents said as well. So you have a structure within the family of an oppositional relationship with the child and the parents. Now, when I'm doing a diagnostic, I'm looking at two things. One is that I'm looking at the container or the parental relationship that the child is growing in, the family environment, the relationship between the parents, each of whom have their own baggage. So when I start out, I may be doing a developmental history with the parents being present and not the child. This gives me a chance to observe how the parents deal with their own feelings about the child, as well as the nature of the relationship between the two of them. Many times I'll see them individually, for starters. The second thing I'm looking at is the child's development in relationship to the chronological age and personal development, and looking at how that fits into not only the family structure, but the relationships at school and their academic performance. And I'm going to stop here and invite you to give me a call if you'd like to, for you to ask me any questions that you'd like. Thanks for listening.